Human metapneumovirus, HMPV, is a respiratory virus that can cause illnesses similar to the flu or a common cold. It belongs to the Metapneumovirus family, which is a part of the Paramyxoviridae family, the same group that includes viruses like respiratory syncytial virus, RSV. Signs and symptoms of HMPV infection. HMPV infections can range from mild to severe, and the symptoms are similar to those caused by other respiratory viruses. They typically appear 3 to 6 days after exposure to the virus. Common symptoms include cough, runny nose, sore throat, fever, mild to moderate shortness of breath or difficulty breathing, in more severe cases wheezing, fatigue, muscle aches, nasal congestion, decreased appetite, in children in more severe cases, particularly in vulnerable populations. HMPV can cause pneumonia, bronchiolitis, or bronchitis, leading to hospitalization. At-risk populations for severe HMPV. While anyone can get infected with HMPV, certain groups are at higher risk for developing more severe complications. Infants and young children, particularly those under 5 years old, whose immune systems and respiratory systems are still developing. Older adults, especially those over 65, whose immune systems may be weaker. People with weakened immune systems, individuals with conditions such as HIV/AIDS, organ transplant recipients, or those undergoing chemotherapy. People with chronic respiratory conditions, those with asthma, COPD, chronic obstructive pulmonary disease, or other lung diseases may be at higher risk. Premature infants, premature babies have underdeveloped lungs and immune systems, which can increase the severity of the infection. Transmission. HMPV spreads similarly to other respiratory viruses through coughing and sneezing, droplets, by touching surfaces contaminated with the virus and then touching the face, eyes, nose, mouth. Treatment and prevention. There is no specific antiviral treatment for HMPV. Treatment generally focuses on managing symptoms. Rest. Fluids. Pain relievers, for example, acetaminophen or ibuprofen in severe cases. Hospitalization for oxygen therapy or other interventions may be required. Preventive measures include hand washing and using hand sanitizers, covering the mouth and nose when coughing or sneezing, avoiding close contact with infected individuals, cleaning and disinfecting frequently touched surfaces. Most people with HMPV recover on their own within 1 to 2 weeks, but in high-risk populations, medical intervention may be necessary.